federal dollars are new dollars that provide jobs and services and money that circulates throughout our economy that we need right now. We're in a recession. There are more and more families without health insurance, families that need help with just basic costs of living, including the cost of going to paying for your doctor bills, hospital bills, and all the rest that you need. So the current budget that's been presented has terrible cuts that reduce provider payments, mental health services for kids, long-term care services for the elderly. And just yesterday, Governor McDonnell's proposal was released, and in there's more bad news. More cuts to providers, more cuts to long-term care, freezing the famous program so that 30,000 children who are uninsured would lose their health insurance coverage. These are not the kinds of cuts. This is not the kind of Virginia we want to be in. So I think it's important for people, when you talk to your legislators, talk about the human impact, but let's also focus on the economic impact. All those Medicaid dollars that we're forfeiting are dollars that support our economy and jobs. The Hospital Association came out yesterday saying that the $700 million in cuts to Medicaid actually translates into $2.6 billion of lost dollars in Virginia's economy. We just can't afford that now in this recession. So let's remind the legislators about the impact on jobs and the impact on our economy. And then we could also remind them about the impact on people. And one of my favorite phrases from about 20 years ago when I was fighting healthcare cuts is, health cuts make me sick. Health cuts don't heal. And that's the kind of message we need to let the folks up the hill hear. Thank you. Thank you.
Here today is Senator Donald McCutcheon, who represents Virginia's 9th District. He has most recently spoken out against Delegate Marshall's bill to opt out of health care legislation passed by Congress. And he has been a champion on health care issues.
Good morning. Good morning. Can y'all hear me okay? Yeah. All right. It's good to be with you this morning. I applaud you all for coming out here. But let me share a couple of words of the United States. But if we're going to prove that was more than a movement, if we're going to prove that we're ready to govern, we've got a lot more work to do. And that work includes organizing. And that's why I'm so happy to see you all here today, because we have got to keep the pressure on. You know, it might be cliche, but you know, democracy really is a contact sport. And what I mean by that is you have to stay in contact with the legislators. You got to keep talking to us. You got to keep reminding us of why you sent us here and what you expect of us. You have heard a lot of stuff about the budget cuts, and I'm not going to recite that for you. But one of the things that I don't think you may have really focused on yet is right now, today, as we speak, there is no car tax relief in the budget. Now listen to me carefully. There is no car tax relief in the budget. So what that means is, what Governor McDonnell is really talking about is, he's talking about these health care cuts for the benefit of car tax. And I don't know about you, but I've talked to the people in my district. The people in my district are good people, just like people all over Virginia. They know these times are tough, and they much rather pay their car tax than to put healthcare workers out of work. That's the message. That's the message that we have to keep pushing. We're not prepared to sacrifice, whether it's education, whether it's healthcare, or anything else at the altar of Jim Gilmore's car tax. He told us it wouldn't get higher than 600 some odd million. It's $950 million a year. Imagine what we could do with that. That $950 million a year more than covers those cuts that were handed down yesterday on Ash Wednesday. Again, I thought that was ironic. On Ash Wednesday, we're being asked to give up certain things for Lent. I'm not prepared to give up your health care. I hope you're not either. I got to go to caucus. God bless y'all for being out here.
Our next speaker is Tammy Rostoff. Tammy Rostoff is an owner of Rostoff's Coffee and has seen firsthand what the rising cost of health and insurance does to small business.
And I would try without it because I don't have it memorized. So, good morning. I want to thank Healthcare for America Now, the Main Street Alliance, and the VOP for organizing this very important rally. This rally brings us together with the common interest of keeping affordable health insurance reform alive and moving forward. My name is Tammy Rostoff. I own Rostoff's Coffee and Tea here in Richmond. I am not a policy expert. What I am is fourth-generation small business owner. My father started the coffee shop 30 years ago, and I have continued in the family business. I support the Richmond economy by giving work to 5 full-time employees and 4 part-time. I offer health insurance benefits and retirement. My commitment to my employees has been against the harsh reality of the ever-rising cost of health insurance. Being raised in a family of small business owners, I was taught early on that you treat your employees not like paid staff, but your family. They take care of the family business, and you take care of them as you would your very own family. This includes the security of being able to see a doctor when they get sick. For years, I've seen my premiums steadily growing. 5 years ago, my business could no longer support the high cost of our health insurance, so I made the choice to change to a high deductible plan. My deductible was $2,000. Over the last 5 years, the premiums have increased at a constant rate. In January of 2009, I was paying 10% of my total salaries to cover only 3 of my 9 employees. Then the unthinkable happened. I had to make a claim with my health insurance company. I had minor outpatient surgery. I knew this would increase my premiums when the renewal came due, but I never imagined the health insurance company would increase it by 42%. Our monthly costs will go from $856 a month to $1,004. I can hardly imagine what the private insurance company would want me to pay if someone in my group was seriously injured or was diagnosed with a chronic illness. I have now taken on the arduous task of getting my group onto new insurance. I chose a plan that would only increase the premiums by 19%, and I have raised my deductible to $3,000. Like I said, I am a small business owner. I am not a policy expert, but I can see how we need strong, effective premium regulations and how a federally administered exchange would create more competition and keep the cost of premiums down. I do know that at the rate things are going, I will not be able to offer health insurance to my family of employees. In the last year, I've been riding a roller coaster of emotions about the possibility of health care reform. And so far, the results have been very disappointing. It made me sick to learn that Anthem made $3 billion in profit in the last quarter of 2009, while I will have to sell 2,429 pounds of coffee this year just to cover my employees' premiums. If I am forced to choose between health insurance and keeping my business going, I'll have to choose my business. Many small businesses may have to do the same. But then we will be a nation of uninsured people, both medically and in the faith of our government. Thank you.
Reverend Hazlitt is a pastor of United Church of Christ and it also works closely with the Virginia Interfaith Center for Public Policy.
Thank you. I come speaking not just from a theological perspective. Before being ordained in ministry, I spent some 20 years in our healthcare system as a member of the American College of Healthcare Executives. I'd like to remind the governor and our legislature that our budget is a moral document, and what we have been presented here in the last few days is an immoral document.